Direct anterior hip replacement has several advantages both for the surgeon and also for the patient. As the surgeon, the things that I like about the anterior hip replacement are that I can have the patient laying flat on their back during the operation and not on their side. That allows me to image the patient's anatomy while I'm working, and to, as I recreate the patient's anatomy with these prosthetic implants, I'm able to see better where my implants are. From a practical standpoint, the patients enjoy a much faster recovery. I do think it's important not to try to oversell the anterior hip replacement as something more than a hip replacement. Basically, the posterior hip replacement has a great outcome. In fact, at 6 months after surgery, both the anterior and the posterior hip replacements cannot be distinguished in terms of their long-term outcomes, at least in our data so far. So I don't believe that patients who have had a posterior hip replacement have somehow had a worse operation or a lesser operation. But anterior hip replacements do recover much quicker because we have not caused the amount of trauma to the muscles surrounding the hips. And patients also are at much lower risk of dislocation. In the published literature, about 1 in 20 total hip replacements done through the posterior approach results in a dislocation. And through the anterior approach, that number is much, much less, depending on the study, somewhere in the 1 in 700 total hip replacements. Although it's possible to dislocate the hip, it's much more difficult.